The Westchester Orthopaedic Institute at White Plains Hospital Center and hip replacement surgery.
Most people are quite active, and people in their 40s, 50s, and 60s really don't believe that they have an arthritic hip, so they'll come to me typically with a history that I have a groin pull that just doesn't get better. People limp, and people put up with a lot because this is a degenerative condition, and you don't have to anymore.
Ernestine Hess lived with two bad hips for years. Over time, the pain got progressively worse. Medication, ice, and heat therapy gave only temporary relief, so she looked into options for hip replacement surgery.
Dr. Small went through every procedure that was involved in the surgery. Told me how long it would take, how long the rehabilitation would take, described the prosthesis to me, described the surgery incision, and assured me that I would come out of it very well.
Dr. Robert Small is an orthopedic surgeon and 25-year veteran at White Plains Hospital Center. He is director of the Westchester Orthopaedic Institute, a collaborative treatment program developed by White Plains Hospital Center and a team of locally based, board-certified orthopedic surgeons. The Westchester Orthopaedic Institute provides a full range of orthopedic surgical and non-surgical services to relieve pain and improve function. These include highly specialized and advanced methods of joint replacement surgery, corrective spinal surgery, and the repair of athletic injuries.
This operation is performed with a team that I work with all the time. And patients do quite well because the surgery is done quickly and there's minimal disruption to the tissues. Most people are able to walk with a cane by about a week to 10 days. And I've let people drive, if it's the left hip, by 2 weeks, and if it's the right hip, by 3 weeks.
White Plains Hospital Center has the highest volume of hip and knee replacement surgery in Westchester County. All the orthopedic surgeons have extensive training at major academic medical centers, and they use the same equipment and procedures as those medical facilities do.
The incision is made, it's typically 8 to 10 centimeters long. The muscle is split along the lines of its fibers. It's not cut. We then open the back of the hip capsule, cut 2 tiny muscles. The hip then gets dislocated from the socket. We take a saw and actually cut the ball off of the femur. We then turn to the hip socket and machine that out to accept the artificial socket. And that gets impacted in there with a mallet. There's a little tight fit in there, and it holds it right away. The femur gets reamed out with special reamers, much like a drill bit. I use a computer to help me determine the sizes and the fit to help equalize the leg lengths. We then insert the prosthesis into the femur. We select the appropriate sized ball, place that on top, and put the hip back together. Close the skin, put the dressings on. This is a titanium implant, and there's a fuzzy coating where the bone can grow into it, and it becomes incorporated in your body, so that these things are pretty permanent, and they can last a lifetime.
The orthopedic unit is a 26-bed facility with private and semi-private rooms. Nurses make hourly rounds to make sure patients have everything they need. Orthopedic certified nurses, specialists, and physical therapists are on hand to outline your program. There's even a medical gym with a simulated at-home activity center.
I never felt pain. I felt discomfort, maybe a little soreness, but the next morning the nurses came in and I was up and walking with a walker. A few steps. They are so specialized and so attuned to what your problems are and to what your limitations are. I cannot laud high enough the quality of the nursing staff.
I think one of the nice things about White Plains Hospital is it's more personal. You're not part of an assembly line. The doctors know who you are. When you come to see me, I do the surgery. We have a dedicated team. We have a dedicated orthopedic floor. And the nurses and the doctors and the therapists all care and want people to get better quickly.
I had it done, and it was the most positive experience of my life. My life has changed completely. I have to tell you, I never felt as though I was being cared for individually as much as when I came to White Plains Hospital.
I'm Bridget Quinn. To learn more about the Westchester Orthopaedic Institute and hip replacement surgery, please call our team at 914-681-2663. White Plains Hospital Center, striving for excellence in everything we do.